Hello, everyone. This is Karen Bass. I am your new member of Congress. I've been in Congress for a full 3 weeks, and coming from Los Angeles, everything has been wonderful here. I've really had an easy time getting adjusted to a very big institution, and probably the biggest adjustment I've had is to the weather and learning how to handle the snow. And those of us in Los Angeles know we have no idea what to do with that. So I'm very happy to be able to speak with you tonight. And one of the big reasons I wanted to do this town hall over the telephone is because I'm not going to be able to come home as often as I did when I was in Sacramento. So this is an opportunity for me to let you know exactly what's happening here and for you to stay in touch with me and ask any questions you might have. I have to tell you that last week when we actually took a vote health care reform, I became very concerned that friends in Los Angeles might believe that health care reform is actually going to be repealed. And now that, if you have a pre-existing condition or if your kid is 23 years old and doesn't have to be dropped from health insurance and you can get health insurance for pre-existing condition, I didn't want people in Los Angeles to be confused and think that health care is actually repealed. The other thing is that I hope that you saw the president last night. I thought he gave a wonderful speech and would love to know what you thought about that. And so I just wanted to let people have an opportunity to ask questions. I know you all have been watching the news, and there's so much confusing information, frankly, put out on the news, that I thought we would open it up in a minute and take your questions. And I'm happy to take a stab at answering your questions, and if I don't know the answer, we'll find out what it is. And I'm going to encourage you all to go to my website, and also hopefully you'll give me your email address before it's over, and we can stay in touch. So if you would like to ask a question at any time in this call, press 0, and there will be someone to take your question, and I'll be able to answer it promptly. So maybe we can go ahead and get started soon with questions. And while we're waiting for the first question, let me just tell you a little bit about the process. So last week, in the House of Representatives, the vote was to repeal health care. And the reason for that is because on November 6th, more Republicans than Democrats won. And so since the Republicans are in charge, their first order of business, sadly, was to repeal health care reform. But I want you to know that nothing else is going to happen because I don't believe that the Senate will even bring this up for a vote. If by some chance they did bring it up for a vote, it won't pass. By some chance, if it did, if you watched the president last night, I think he was very clear in saying that he would veto it. That if people want to improve health care reform, then we should do that. Because any time you pass a major piece of legislation, there's lots of things that need to be tweaked, changed, fixed, etc. And so there's time and ample opportunity to do that. But one thing that he will not put up with, and I was very relieved to hear him say it, even though I knew he thought it, that he was not going to go along with repealing health care reform. If we look back in our history, when we had Social Security, when we had Medicare, when we had the Voting Rights Act even, when you first do a major sweeping change, it takes years of tweaking and fixing and changing before you actually get it to where it's a good functioning change of public policy. And healthcare is going to take that while as well. So if you want to ask a question, press 0, and I guess I should ask if we're ready for any questions.
Hi, Karen, this is Kurt Cervity, and I'm helping out with the call tonight. Again, do hit 0 if you have a question of the Congress member. We really appreciate all your participation. Again, that's 0 on the keypad on your phone. I think we ought to take a question if we can. We're going to have Les. Les, welcome to our telephone town hall meeting we're having tonight with Congressmember Karen Bass. What is your question, please?
I'd like to ask, please, if I could, that although I know that California is really suffering as far as finances is concerned, the majority of elderly.
Uh-oh. Did we lose you? Maybe we'll get him back. Well, while we're waiting for another question, I think I would like to go over some of the points that the president made because, I thought he did such a good job, and it was very exciting to be in the room last night. I did have an opportunity to hear the State of the Union for the last 2 years, so this was the third time, but it was the first time, of course, that I heard it as a member of Congress. So, I think one of the most important points that the president made was it's really about the future, that we as a nation have to out-innovate, out-educate, and out-build the rest of the world. And that's such an important point because I know that people listening to this call know that if we don't figure out a way to fix our education system, we are going to fall so far behind the rest of the world. And so it was exciting to hear him make that commitment and talk about respecting teachers in the way that we should. And to me, if we're talking about respecting teachers, we're also talking about paying teachers. He talked about taking responsibility for our deficit. We do have to find ways to close the deficit, but not in the ways that some of my friends on the other side of the aisle want to do, which is essentially to do massive, massive cuts that I am afraid, frankly, is going to contribute to our unemployment rate. We're talking about reforming the government. He said he was going to come up with a comprehensive package to look at, the federal government is so big and there's so many different duplicative agencies that he's talking about consolidating and reforming so that we can actually trim government. He talked about innovation, and that's a really important subject in California because California has been the center of innovation, not just for the country, but really for the world if we think about all of the things that have originated in our state. Most importantly, California is years ahead of many other states when it comes to clean energy. And the president talked about by the year 2035 that 80% of our electricity will come from clean energy sources. And I know that people in California like the idea of ending the oil subsidies. That's something that we've tried to do in California for a while, not ending the subsidies, but, California is the only oil-producing state in the country that does not charge the oil companies a fee to extract oil from the land. He talked about infrastructure and building infrastructure. And, when I hear that word, to me in Los Angeles, the first word I think of is transportation and what we need to do to get some of those cars off the freeway. So I think it was an exciting speech, and I look forward to hearing your feedback and what you thought about the speech.
We're ready for another question if they're ready for one if we could. I want to remind people that if they did have a question of the Congress member, please hit 0 on your keypad now. Hit 0 on your keypad now, and we'll get you to her as soon as we possibly can. Francis is next. Francis, welcome to our telephone town hall meeting we're having tonight. What's your question, please?
Okay. Actually, I have two related issues. I'd like to know what the congressman's thoughts are on this. It's regarding holding healthcare costs down and keeping people healthy. I read that our supplement industry is under attack. I've been a supplement taker for 20 years. So is my mother. She's 88 and healthy. And there is a new, it is called a thermography. It can detect cellular changes in the breast through heat 10 years before anything shows up on a mammogram. Doctors don't promote it. It is not strictly diagnostic. Congressman, there are very many preventive measures which are new and innovative. I would like your comment on how these things can be brought to the public's attention, how doctors can be persuaded to begin using them, and please, our supplements need to be protected. No one ever died from a vitamin pill, but over 100,000 people are killed each year by doctor-prescribed drugs. Please comment.
Sure, and you know what, I have to tell you that I had difficulty hearing the first part of your question, but I did hear the second part where you asked about supplements. And I know what you're referring to has been a long study, but I will assure you that as far as I am aware, that is not on the agenda in this legislative session. I was trained in family medicine, practiced as a physician assistant for a number of years, and also worked in the emergency room. And so I'm one that believes in a variety of methods of prevention and also healing, and I think that they all need to be a part of our healthcare system. I do think, sometimes people can misuse supplements just like you can anything else, but on the other hand, I certainly believe in a lot of different alternative treatments and preventive measures.
Thank you, Congressmember. We're going to ask people that if they want to keep up to date with what's going on here, all they do is have to provide us with their email address. And in order for you to provide us with your email address, all you have to do is press 7 on your phone now. Hit 7 on your phone now, and what will happen is you'll end up going to one of our staff, and they will take down your email address. So if you want to get the latest, greatest newsletter, the electronic version of it, it saves a lot of money going green that way if we can. Just hit 7. Hit 7 on the keypad on your phone now, and we'll get you to one of our operators as soon as we possibly can. We really appreciate the participation, the help on that. We have a polling question next, and the question is, and you get to vote. You get to vote on the keypad on your phone again. Did you like the President's State of the Union speech last night? If you liked it, press 2. If you didn't like it, press 3. If you didn't watch the speech, press 1. Again, the question is, did you like the President's speech last night? Press 2 for yes, 3 for no, or 1, you did not watch the speech at all. And we'd appreciate all your participation on that. At the end of this call, towards the end of the call, we'll give you results. We're going to take Maria next. There we go. Maria, welcome to our telephone town hall meeting we're having tonight. Maria, what's your question, please? Go ahead, Maria.
Yeah, I already placed my question.
But you get to say it over the air, so go ahead with it if you would, please.
I just would like to find out, I hear so many things regarding home health care. They say that the government would like to remove home care for seniors. Is that true?
Well, let me just tell you that it isn't true that the government would like to remove it for seniors. The state government as well, because I will tell you that was a real challenge we had with the previous governor. I feel a lot better about our current governor, though. For some reason, Schwarzenegger was really anti-home health, and I don't think that Governor Brown is, but I can tell you that there isn't anything in health care reform that was passed by Congress that eliminates home health. Is there another question?
We're going to take another question in just a second if we can, please. I think we're going to take it from Yvette. Yvette, are you there?
Yes, I am. Can you hear me?
I can hear you loud and clear. Go ahead with your question, please.
Okay. My question is, what do you think, Karen Bass, that we the people, those of us who are out here in the real land, needs to do to let folks know that we support the health care reform legislation that was enacted last year, and that we wanted to move forward? I think there's a misnomer out here that people don't support that in some way, and you've got all these folks, speaking out, but I want to know what we can do to let people know we want this and we want it to move forward.
You know what? That's a wonderful question. Thank you very much for taking the time to ask it. We have a new speaker in this building named Boehner, and I think that it would be very good to communicate to him and to tell him that we do not want health care repealed. And I will tell you that before the call is over, I'm going to tell you how to contact Mr. Speaker, okay? And I do believe that it would be very good, because I get tired of hearing that people want to get rid of health care reform. I know that's not the case in my district. And I'm not sure what districts, some of these folks come from. I actually think that one of the big reasons is because so much confusion has been spread about what health care reform is and what it isn't. So why don't you give him a call His phone number is area code 202-225-0600. This is Mr. Speaker. You don't even have to remember his name. Just Mr. Speaker is the most important. His name is Boehner, but Mr. Speaker is what you need to know. He is the one that controls the agenda in the House of Representatives, and of course I know that because for those of you that don't know, I was the Speaker in the state of California, and I know with his power he could actually turn this around.
Thank you, Congressmember Karen Bass. We appreciate your answer on that. We're going to take another question if we can, please, and it looks like it's going to be David. David, welcome to our telephone town hall meeting we're having tonight with Karen Bass. What's your question, please?
Hi, you talking to me?
I am talking to you. Go ahead, sir.
I asked before about whether the high-speed rail line is going to continue or and where it's at between LA and San Francisco.
I'm sorry.
I'm asking about the high-speed rail line. What's happening?
Where is? It is well, the high-speed rail. You know, they actually changed it. You know, the first leg of it was supposed to be from Orange County to L.A., but because there was a lot of, I guess, a lot of questions raised in the L.A. area, they changed the route now, and now the first leg of it will be in Central California. I was disappointed by that. I was hoping that it would be, you know, in our area. And, you know, California was leap years ahead of everybody else in the country. We were the first state in the union to pass a bond to fund high-speed rail. So when the president decided that he was going to prioritize high-speed rail, California got the bulk of the money. And so we have billions of dollars, which will eventually lead to thousands of jobs, and, you know, it'll take a while. It'll probably take us a good 10 years for high-speed rail to be built, but the first leg of it will be in Central California.
Thank you, Congressmember Karen Bass. We appreciate everybody's participation tonight. We have another polling question, and the polling question is, what, if anything, do you think Congress should do about these important health care changes and patient protections? If you think press 2 on the keypad on your phone if you think the health care law should be expanded or left as it is. Press 3 if you think these important patient protections should be repealed, or press 1 if you don't know. Again, the question is, what, if anything, do you think Congress should do about these important health care changes and patient protections? Press 2 if you think the health care law should be expanded or left as it is. Press 3 if you think these important patient protections should be repealed. Press 1 if you don't know. Again, at the end of this call, which is at the top of the hour, we'll provide you with results, and we really appreciate your participation. We're going to take Gary next, but before we take Gary, I want to remind people that the district office phone number, if you need information from the district itself, Karen's office number in the district is 323-965-1422. Again, that number is 323-965-1422. If you want the email address, the web address is karenbass at house.gov. If you want some more information on on what's going on. Meanwhile, let's get to Gary. We said we would. Go ahead with your question, if you would, please.
Okay, my name is
Jerry. Okay,
Jerry,
go ahead.
I have a comment. I was happy to see that the Republic and the Democrats are now working together, because the Republic has a lot of older people with wisdom, knowledge, and experience, and the Democrat leader is an educator. And I think with all that, we are going to be united, and we're going to make he's going to make a good leader, and things are going to work better. And I've seen a lot of smiles that he was welcome. And as a black educator myself, I appreciate them working together. It takes not one person to lead this country, but it takes more than that. It takes knowledge, wisdom, education, and experience. Thank you.
Well, I certainly hope that that's the case, and I have to tell you that there was a lot of excitement in the air last night, and, we did this experiment of sitting in each other's area. I sat on the Republican side, and I sat with the senators, and so we mixed it up a little bit, which actually I'm used to, because that's the way we did it in Sacramento. We didn't have Republicans on one side and Democrats on the other side. So I'm hoping that that will be a new tone and we'll be able to move forward and get some things done for the country.
Thank you, and if we can, please, Karen, we're going to take another question, and it's going to be from Donna. Donna, welcome to our telephone town hall meeting we're having tonight with Karen Bass. What's your question, please?
My question is infrastructure. Why is it such a difficult problem of putting our city workers back to work, fixing the potholes? We're having a problem in Los Angeles with a lot of potholes. Even though they get reported, I'm seeing that we're still not getting any progress of getting all the potholes fixed. Meanwhile, people are complaining that they're tearing up the bottom of their cars. Why can't we put our people back to work, get them back to work, get our roads back in order so that we can have better roads?
Well, let me just tell you, I'm with you on that, especially after these last rains that we had. Boy, I almost ruined my car, too. Well, let me just say that in terms of the city, unfortunately, the city is going through a terrible budget crisis, too, and because they are so short of money, they can't pay the workforce, and so they've had to lay off people and cut back people's hours, and so that has really led to it being very difficult for them to meet all the needs. And you add on top of that the fact that we had a really, really, really bad rainy season. You know, it wouldn't have been so bad with the potholes if it hadn't rained so hard. So you have the crisis in the weather, you have the budget crisis in the city. You know, on the federal government side, the money trickles down, right? So if the federal government cuts the money, if the state cuts the money, then the cities get less, and that impacts our ability to have safe roads. That's why it was nice to hear the president last night say that we have to outbuild the rest of the world. And so he is talking about putting resources in for infrastructure, and I'm hoping that that money will trickle right down to L.A. I do have to say, though, that I'm worried as to whether or not my Republican colleagues will be willing to go along with the investment that the president wants to make. We can't do it without their support, like the last caller. So I'm hoping that they'll be supportive of the president's plan for infrastructure.
Thank you. Thank you, Karen. We're going to take another question if we can. It's going to be from Tony. Tony, welcome to our telephone town hall meeting we're having tonight with Karen Bass. Tony, what's your question, please?
Yes, hello. I was concerned at what the president said when he addressed the issue about cutting funding. One of the things he emphasized is cutting the community action program. I'm working in that field, and when you look at what is happening in our communities with so much unemployment, people who are losing their homes, with drug abuse and the problems in education, the community action program is there to address those issues and help people. This is a key concern of mine, and as much that when you look at the type of money that we're spending in the war, and I was disappointed that the president didn't talk about the war and all the money that's going to be poured into there, we need to get out of Afghanistan and bring the troops home, and we need to deal with more spending domestically. And so I would like to get the Congresswoman's basically opinion on the war and also the cutbacks in community action programs.
Well, let me just tell you that I share that concern with you. I kind of flinched when I heard that as well. And I have to see basically, the timeline is that what you heard from the president were his goals, his ideas, his vision. In mid-February, he will actually present us with his budget, so we will see exactly what he means. I don't know what the specific is referring to. So I share your concern. I will tell you that I did get a little relief, though, when he said a couple of things. He said that we need to cut, but he also said that we don't want to have cuts on the back of those who are most vulnerable. Now, you and I know that the community action programs address those who are most vulnerable. So I felt that he balanced it by saying that but I honestly don't know what the specifics are. So I will be sharing that with you and promise you that whether it's in the form of a town hall that we do in person or another town hall that we do over the phone, when I get those numbers, I will share those with you. The other thing he did talk about the wars and saying that, you know, we have taken 100,000 troops out of Iraq so far, and we're going to be reducing the troops more, and we will begin, hopefully, the reduction of the troops in Afghanistan by this summer.
Thank you, Karen. We appreciate everybody's input tonight. We're going to take another question in just a second, but we have a question of our audience we want to ask. You get to vote for this on the phone. Did you like the telephone town hall that we're having tonight? Do you find it helpful? If the answer is yes, press 2. If the answer is no, press 3. If you don't know or haven't made up your mind about it, press 1. Again, the question is, do you like the telephone town hall that we're having? Do you find it helpful? If the answer is yes, press 2. If the answer is no, press 3. If you don't know, press 1. And anyway, we'll give you results at the end of the call. We appreciate everybody's participation one way or the other. We're going to take... yes, go ahead. I'm sorry.
That I said at the top of the call, for those of you that might have joined later, this is a real experiment, and I am very, very interested to know your feedback. One of the reasons I wanted to do this is because, you know, I mean, as a community organizer, I really like to see people and talk to people, and, you know, being in Washington, D.C., I'm not going to be able to come home as often as I did when I was in Sacramento. And so I want to stay in touch, and it's important to know whether this is a good vehicle in which to do that.
We're going to take another question if we can from our audience, and we have a lot of people wanting to ask us questions. You wouldn't believe how many people are trying to ask us questions right now. So if you have a question of the Congress member, what you have to do is you have to make your question really short if you can, because we want to try and get as many questions as possible, so we're going to take Irene next. Welcome to our telephone town hall meeting we're having tonight. What's your question, please? Irene?
Me? Oh, I'm sorry. I just wanted to reiterate my full support for health reform so that everybody in this great country should be covered, because I feel that this is a human right. It's not less important than free speech or any other such right. This is my feeling when I see people and children without care. And just go, what they say, just go to the emergency room or something like that. There is no comparison.
Irene, thank you very much. Did you want to follow up on that, if you would, please, Karen?
Well, let me just say that I agree with you 100%. As someone who spent many years working in healthcare, one as a nurse and two as a physician assistant, I think here we are, the richest country on the planet in the history of the world, and we can't figure out how to provide health care for everybody in our country, I think is shameful. And so the fact that health care reform was passed last year and we can actually cover 31 million additional people, I think is such a significant step, and we have to do everything we can to make sure that we take the second and the third step and not roll back the clock.
Thank you. Thank you for that answer and follow up on that. We wanted to remind people that if they wanted to provide us with their email address, all they have to do is press 7. Press 7 on the keypad on their phone, and we'll have one of our staff take your email address. And what we'll do is we'll provide you with our electronic newsletter, which is published often. Again, hit 7 on the keypad on your phone if you wanted to provide us with your email address, and we'll get you that electronic newsletter. Roberta's next. Roberta, welcome to our telephone town hall meeting we're having tonight. Roberta, what's your question, please?
Hi. First of all, I'd like to say that I'm a big supporter of the Congresswoman and thank her for doing this. Also, I'm a huge supporter of the President. But I was very disappointed that even though he had ample opportunity, he didn't mention anything about gun violence. Everybody was wearing their lapel ribbons, but I think some of the discussion that the Mayors Against Illegal Guns has been asking for improved background checks or renewal of the assault weapons ban or bans against these high number of magazine clips could have been mentioned, and I wondered if the Congresswoman has any plans with regard to gun violence.
Well, thank you so much for your question, and thank you very much for your support. I appreciate that very much. You know what I heard, and the minute I get more details, I'll absolutely share it with you. I heard that he chose not to say anything last night, but apparently plans to do something separate, give a separate speech specifically on that issue. And so I heard that today, and I'll definitely let people know. What we'll do is we'll put an announcement on the Facebook page when that happens. I think it would have been good to have raised that last night as well.
Thank you. Thank you very much for that answer. We're going to take Glenna next if we can. Welcome to our telephone town hall meeting we're having tonight. What's your question, please?
My question is that what has been done from a federal level regarding elderly abuse? Case in point, there is a saying that there are mandated reporters such as teachers, nurses, such as myself, when you suspect or witness or know of a person's being elderly abused. In the case of my father, he was physically abused and financially abused by his sister. Make a long story short, this was reported to Adult Protective Services, who did nothing. This was reported to the attorneys. They did nothing. It was reported to the bank. They did nothing. I reported to all levels of government. And what is being done, and what should I do?
Well, you know, first of all, one thing that I always believe in is that if I don't have the answer, I'm going to tell you that straight. And I will be happy to get the answer for you, and I'll give you my office phone number in a minute. Let me tell you that I am most familiar with elder abuse on the state level, and we have passed very strong legislation in the state of California. It was an issue that I learned about when I was in Sacramento, and I was just appalled on the financial side of it, how adult children of elders are going in and confusing their parents and winding up taking their property and stealing their bank accounts. And so we do have strong laws in California, and we do have elder abuse hotlines and the whole 9 yards. On the federal level, I am not familiar with the elder abuse issue. My office number in Los Angeles is 323-965-1422. 323-965-1422. And if you can give us until Monday, you call that number, and I will have an answer for you as to what the situation is on the federal level with regard to elder abuse. And you can just ask anyone there. I'll follow up with my office and make sure they have an answer for you.
Thank you, Karen. We're going to take another question if we can, and it's going to be from Linda. Linda, welcome to our telephone town hall meeting we're having tonight. Linda, what's your question, please?
Thank you very much. I'm privileged, first of all, to be under a government that is democratic, of the people, and by the people. My question is about health care reform. I've read that certain aspects of it is already in place and active, but I'd like to know what aspects of that reform is available. And secondly, I'd like to know the specific reasons why the GOP is opposed to health care reform. And I know that they are against our president, but I'd like to know specifically what are they against in the health reform package.
Well, you know, one of the assignments they've given me here is to sit on the budget committee, and so we had a hearing today, oh my goodness, it went on for about 4 hours on the budget committee. Instead of looking for ways for Americans to get jobs, our first order of business was talking about the repeal of health care reform. Their number one issue is that they say it costs too much. And they say it's a government program, and they call it the government takeover of health care. The funny thing about that is that they support Medicare. Well, who do you think runs the Medicare program? The federal government. And it's interesting. I mean, it's a different philosophical viewpoint. I think they would be more supportive of the insurance companies and more supportive of what they call the free market. I was doing some background reading, and part of what they are proposing is to give people a tax credit so that every individual would have $2,500 tax credit and a family would have a $5,700 tax credit so they could go buy their own insurance. My problem with that is that, I just don't think that'll happen, and I also don't think it's affordable. We can give you on the website every aspect of healthcare reform that is in force now and what's coming online in the future. But let me just point out a couple of things, okay, because it's quite a number of provisions. It's about a 4-page document that lays out all of the specifics that have gone into effect already. And so we'll put it on our website and we'll tell you that information later on in the call. But for example, if you are a parent that has a 23-year-old adult child, you can continue to carry that child until they get 26. And I know a lot of people, including myself, didn't even know that the insurance got cut off when you were 23 until I got a letter saying my daughter was going to be cut off. If you have a pre-existing condition, and let me tell you, after you hit a certain age, everybody has a pre-existing condition. If you have a pre-existing condition, health insurance companies can no longer, let me say it the other way. Health insurance companies have to cover you. They can't exclude you. The other thing that has gone into effect already is that if you get sick, let's say you have a catastrophic illness like cancer, if you have breast cancer or any form of cancer, and your treatments cost X amount of dollars, the insurance company can no longer say, hey, you know what, you're getting too expensive, we're cutting your health insurance. Health insurance companies can no longer do that. So that's just 3 examples of provisions that are already in effect, and we will give you far more detailed information on the website. But we have a lot more to go with health care reform. I'm very excited that this was such a significant step in our country, and I look forward to being here in Washington, D.C., and working on health care reform over the years. Let me talk about another area that isn't commonly talked about. The new health care reform law is going to cover 31 million additional people. Well, if anybody's been to a hospital any time over the last few years, you know that we don't have the workforce now to cover people. We recruit nurses from Canada. We recruit nurses from the Philippines. There's all kinds of professions in the category of health care. The health care bill was a jobs bill. We are going to need tens of thousands of phlebotomists, radiology technicians, nurses, doctors, PAs. For our future in terms of jobs, the healthcare industry is going to be the place to go because it's going to be expanding. And I think it's unfortunate that a lot of times it's not talked about as a jobs bill. It absolutely is a jobs bill for our future.
Thank you, Karen. We're going to take another question in just a second, but we're going to ask a polling question we asked earlier in the call, but not everybody was on the line just yet. The question is, did you like the President's State of the Union speech last night? If the answer is yes, press 2. If it's no, press 3. And if you didn't watch the speech, press 1. We appreciate your participation. Annette, you're next. Annette, welcome to our telephone town hall meeting we're having tonight with Karen Bass. What's your question, please? Annette. Annette, you're on. Go ahead, please.
Hey, hello?
Yes, go ahead. Go ahead and ask your question if you would, please. We're on live.
My question is about federal civil service retirees' benefits. Now, there's been no COLA increase for the past 3 years, and my understanding is that there will not be another COLA increase for the next 5 years. And I'm trying to figure out what we are supposed to do with taxes going up. I live in Los Angeles. Meds going up, food, gas, utilities, everything is going up except my income. What are senior civil service retirees supposed to do?
Well, let me just tell you that, well, first of all, on the price of medicine and all, as healthcare reform gets implemented, hopefully you'll see some relief there. But I just have to be honest with you. The environment here in Washington, D.C., with the Republicans wanting to cut everything under the sun, I think the fight is going to be to preserve what is already there. I don't believe that there will be a COLA increase, but I don't know. This is the first time I've heard this thing about 5 years. I don't believe anybody has capped it for 5 years, but I can't imagine that we would be able to get past a COLA increase this year in this environment.
Thank you, Karen. Before we take Stan, I want to remind people that the web address is karenbass.house.gov. So you can go to that website and you can sign up for emails there if you choose to. You can read all about what's going on. It's a pretty good source of information. Stan, as I said, is next. Stan, welcome to our telephone town hall meeting we're having with Karen Bass tonight. Stan, what's your question, please?
Good afternoon. What I'd like to get familiar with is the president mentioned he was going to eliminate No Child Left Behind, and as an educator, he piqued my interest by bringing up a race to the top. So I was wondering, all morning I heard the other side, or the Republicans, saying that it was going to be very costly and they wouldn't be able to implement it. So I was wondering, if you were just going to substitute one for the other, why would it be so much more costly?
Well, he is talking about doing Race to the Top and making some fundamental changes in No Child Left Behind. I'm sorry, I'm not familiar with what you were hearing today in terms of the other side. If you are referring to the Republican response, the Republicans' general response on everything the president said is any time the president used the word investment, they translated that to say spending more money. Some of these people here are talking about wiping out the Department of Education, so you can imagine that they're not going to be in favor of investing any more money in education. And that's an important fight that we have to have here, because one of the things that the president talked about that I think is absolutely right is the respect for teachers and the fact that, if you say you want people to go into the teaching profession and you say you respect teachers, then you got to pay them. You have to have the incentives for people to want to go in the profession and to stay there. So I know his agenda is to make sure that we invest in education. I'm not sure what the Republican agenda for education is, but I think that that's what you were referring to when you were saying that they were saying they weren't going to put any more money into it.
We're going to ask a polling question we asked earlier. Not everybody was on the line, just as before. What, if anything, do you think Congress should do about these important health care changes in patient protections? And you get to vote for this on your phone. Press 2 on the keypad on your phone if you think the health care law should be expanded or left as is. Press 3 if you think these important patient protections should be repealed. Press 1 if you don't know. We'll give results at the top of the hour just before we end the call. We really appreciate your participation. Mark, you are next. Mark, welcome to our telephone town hall meeting we're having tonight with Karen Bass. What's your question, please?
First, I want to thank the Congresswoman for holding this call. I think it's a great way to reach out to the grassroots. I'm sorry about the cold weather out there. We're having great weather out here in L.A. But I want to say I was disappointed with that the President made no mention of attempting to repeal the Employment Non-Discrimination Act or the Defense of Marriage Act last night during his speech. And I find that although we got Don't Ask, Don't Tell repealed, that he's been slow to act on gay rights issues. And I wonder what your opinion on both of those issues are, and your opinion on gay marriage and what the Democratic Party can and should do in this session of Congress to forward those causes.
Okay, I heard you say the Defense of Marriage Act, but my opinion on marriage equality has been pretty public. I've voted on it several times when I was in the state legislature. I have never understood why people were concerned about who married who. And then the Defense of Marriage Act, certainly think should be repealed. I can't comment on, what the president said or didn't say in that regard. I know, it was a very interesting moment when he mentioned don't ask, don't tell. I just have to tell you that. And so anyway, it'll be interesting to see where he goes in the future. I'm sorry if I missed part of your question, but I think I answered both parts.
I think you covered it just fine. We're going to ask Lena her question next if we can. Welcome to our telephone town hall meeting we're having tonight with Karen Bass. What's your question, please?
My question is, I got a notice not too long ago that my Blue Cross Blue Shield would be going up almost $50 more, and this will be taken out of my retirement. And I was wondering how this could go through and no one's saying anything. That's a lot of money since we're not getting an increase in retirement or Social Security.
Well, let me just tell you that there absolutely is somebody saying something, and his name is Dave Jones. He's our state insurance commissioner. We are really lucky in California to have Dave Jones as insurance commissioner and Kamala Harris as our attorney general, because what the insurance companies did is they spiked the rates before health care reform went into effect. They tended to do this at the end of last year, and you should know that Dave Jones is challenging that, okay? And you should go to his website and you should contact his office and you should let him know about your specific situation. But I won't be surprised at all to see that get reversed. In our state, the two individuals who have the power to make sure that California implements health care reform in the right way are the Attorney General and the Insurance Commissioner. Some of these other states have Attorney Generals that are trying to block health care reform. We have an Attorney General and an Insurance Commissioner that are advocates for health care reform.
Facebook.com/rep, R-E-P, Karen Bass is how you get to the Facebook page for Congressmember Karen Bass. So again, Facebook.com/rep Karen Bass is the Facebook address. Please join us on that if you would, please, when you get a chance at any time. We'd love to have you read all about it, as it were. And Charles is next. Charles, welcome to our telephone town hall meeting we're having tonight. Charles, what's your question, please?
Okay, my question, thank you very much, and this is very helpful. I was born in the East Coast. I came to California as a child. I've been out here over 75 years. Mine is about the housing, the homeowners situation, and the property tax. About this is going to be handled, Obama's program. This is going to be helping the homeowners.
And your question was about that program?
Yes, I wondered because people are losing their homes and the property taxes. It has increased on most of the homeowners.
Well, actually, you know what? If your property taxes have increased, that's a real problem. Your property taxes should have decreased because the property values have gone down. That's some other good news in LA. We have a really good county assessor. His name is John Noguez. His name, I believe it's Noguez. But if you go to the Los Angeles County website, look up the Los Angeles County assessor. Let him know about this because your property taxes should definitely not be going up. And in terms of the foreclosure issue, I am hoping that in the state of California, we will be able to pass some stronger legislation that will hold the banks accountable. Legislation has certainly been passed on the federal level, but there is still so much more that needs to be done. And I know very well from all of the calls that have come in to our office over the last couple of years that the banks are just not modifying loans the way that they would have people feel, and that there's a lot of loopholes that people are getting around well-intended federal legislation. So I'm hoping in the state we'll be able to add some teeth to it. And I have to reference that in the past tense because I don't know under this current leadership that we have in the House that we'll actually be able to pass any additional legislation to really require the banks to work out loans and not just foreclose on people. My district office apparently right now is being overwhelmed with calls So I would encourage you to email me. You can go to my email. It's KarenBass.house. This isn't. KarenBass.house.gov. KarenBass.house.gov. G-O-V. You can go online to my website, and then you can click on Contact Me to send me an email, okay? And we will respond to your emails.
Meanwhile, if you want to provide us with your email address so we can send you out the electronic newsletter that we have, just press 7. Press 7 on your phone right now, and one of our staff will take down your email address. Again, if you want to provide us with your email address so we can send out the electronic newsletter to you, please hit 7. Hit 7 now on the keypad on your phone, and we will get to you as soon as we possibly can. Rosa's next. Rosa, welcome to our telephone town hall meeting we're having tonight. Rosa, go ahead with your question, please.
Good afternoon. I met you, Mrs. Bass, at one of our senior citizen centers, and you were very pleasant. My question is, I would like to know if the president or the government intends to give the seniors any type of increase in the Social Security.
Oh, well, you know what? Thank you so much for your comment. And I have to tell you, I always really enjoy going to senior centers and visiting folks. So hopefully I'll see you again in the near future. You know, I really wished I could tell you that we were going to increase the benefits, but I just have to be honest with you and tell you that, you know, my colleagues on the other side of the aisle who are very concerned about our deficit, and I'm concerned about our deficit too, but I'm a little more concerned about the hurt that I know people are feeling around our country right now. I don't believe there's going to be an increase in Social Security. We're going to be fighting this year to save Social Security because some of my Republican colleagues would really like to turn it over to the private, to Wall Street, frankly. And I'm very concerned about keeping Social Security intact for people. That was our commitment to them years ago, and we should fulfill that commitment.
Our next questioner is Kathy. Kathy, welcome to our telephone town hall meeting we're having tonight with Karen Bass. Now, if you could ask us a question, we'd really appreciate it. Go ahead, please.
Oh, thank you very much. Thank you for this forum. I think it's wonderful. My question is regarding our president's push for energy efficiency. Because last summer, as we all know here in L.A., we had a heat wave that hit 113 degrees, and we lost 2 transformers in my area, so we were without electricity for almost a day and a half. And I was wondering if there going to be any information sent to homeowners for solar energy so we can solarize our houses and be more energy efficient in our community.
Well, you know, I think we have a very good chance of that. We'll have to wait and see exactly the details of the president's budget and his plan around clean energy, but there very well could be tax credits, there very well could be some resources, but we probably won't know the details until mid-February. And I will tell you that if people like this town hall, if this is something that works, we can get back to people with a lot of details on the president's budget when it actually comes out. You know, it's great to hear his very inspiring speech, but until he actually gives us in writing the details, it's difficult to know what the specifics are.
We're going to, speaking of bringing up things, at Rep. Karen Bass is the way to get to us via Twitter. The @ symbol, Rep. Karen Bass. We hope you'll join us with every one of our possible communication tools that we have. And speaking of communication tools, you get to vote on this question. Did you like the telephone town hall tonight? If the answer is yes, press 2. If the answer is no, press 3. And if you don't know, press 1. Alice is next. Alice, welcome to our telephone town hall meeting we're having tonight. Alice, what's your question, please?
My question is about the ESEA reauthorization, but I do want to first say thank you for this town hall. I do think it's great. I work full-time, though, and just happened to be home when the call came through. I am a senior. And so I'm wondering if you're going to be doing this at other times of the day when those of us who work full-time can participate more easily. But my question really is about ESEA reauthorization. I'm wondering what the President is doing to strengthen the voice of young people and parents in low-income communities so that they can have a better participation in decisions about their schools.
Well, the President's plan, and by the way, in the future in Los Angeles, we do plan to do a town hall and go into this in detail. But the President's education reform plan is called Race to the Top. And you might want to Google Race to the Top because you can definitely get the details there. But, in a nutshell, he calls for some decentralization, very supportive of charter schools, very supportive of parents and teachers being able to transform the schools, standardized testing, but also providing the resources. So a school district and or a state has to fill out an application and apply for Race to the Top funding. While I was still Speaker in the Assembly, I was involved in Race to the Top at the end of '08. And we did fill out an application. It went to the federal government. Unfortunately, we didn't get the money. Had we been approved, we would have gotten $750 million for California schools, when frankly, at a time when we cut $11 billion from schools. So I'm really hoping that even in this, Republican environment, that we are able to really make the commitment to our young people. And when you're talking about making a commitment, that means providing the resources. And if you have a commitment to the young folks, then you got to have a commitment to the teachers as well and make sure that they are adequately paid while holding everyone accountable. I will just tell you, though, that I always cringe a little bit when I hear about parent involvement in schools. Of course, I think that that's a great thing to do. Every parent should be involved. I was certainly a very involved parent. But you know what? Not every kid has a parent. And so I just wonder about those kids in the foster care system. We have a couple of schools in our congressional district where 40% of the kids are foster kids. So that's going to be the issue that I plan to pursue when we look at education reform here in Congress.
We're going to review some of the results of the questions, if we may, and give you results as we promised. Did you like the telephone town hall? Did you find it helpful? 82% of the people thought it was a pretty darn good idea. We appreciate that.
Great.
Yeah, isn't that something?
It is. You know what? Let me just say that that's wonderful. It's important for me to know, and I will promise you we will do this again.
Well, we appreciate that, and I'm sure everybody, you wouldn't believe how many people are still on this line right now, Karen Bass. There are a bunch that are listening. And it's been a very exciting session. Did you like the President's State of the Union speech last night? 76% of the people liked it. 19% of the people didn't watch the speech, and just a few people didn't like it. We appreciate you giving us our views on that. And the big question was, what, if anything, do you think Congress should do about the important health care changes in patient protection? 66% thought they should be expanded or left as is, and 25% didn't know, with the rest saying it should be repealed, which was below 10%. So, again, thank you so much for all your participation tonight. We're running out of time, and we're trying to get it. We tried to get as many questions in as we could tonight. I want to remind people, if you couldn't get your question in, or you still wanted to provide us with your email address, all you have to do is leave us a voicemail in the next couple of minutes after we end the call. And you do that by just giving us your name, your phone number, and your email address, because we can get back to you quicker with your email address if you had a question, or you're just trying to provide us with the email address in the first place so you can get our electronic newsletter. So leave us a voicemail. We'd really appreciate it. If you do have a question, the office will get back to you as soon as they possibly can. We're going to have a lot of people asking a lot of questions, so please be patient on our response getting back to you. Karen, tell people why we did this telephone town hall and give us a wrap-up if you wouldn't mind, please.
Let me just say that I really enjoyed the hour. I enjoyed talking to you as I sit in my office and it's snowing really hard outside. It was very nice to be able to connect to LA. I hope to be home in the next couple of days. I really wanted to do this because I'm not going to be able to come home as often as I did when I was in Sacramento. And to me, one of the most rewarding parts of my job as a representative is to be able to connect with people. So since people like this, we will definitely do it again. Tell your friends. Questions that you didn't get answered, if you leave us your email, we will answer those questions. If you go on our website, we will post the questions and answers. Give us a few days, though. It's going to take us a minute because a lot of questions came in. But thank you very much